I damaged my knee 15 years ago while I was downhill skiing, and I really can't put lots of pressure on my knee. Like I can't, like for example, downhill ski anymore. There were many interesting and new things or new treatments I never experienced before. Magnetic, electric, some laser stuff that was really interesting and made my knee feel less painful. Everybody is really friendly here. I feel like home. Feel taken care of. It's very fascinating area to me, the stem cells therapy, and I can see that it could help like range of people with different diseases which they can't really get healed on the traditional medicine. My name is Marius. I'm from Estonia, and what brought me to the clinic is that I damaged my knee 15 years ago while I was downhill skiing, and since then I had 2 surgeries, but it's still like a little bit swollen up, and I really can't put lots of pressure on my knee. Like I can't, like for example, downhill ski anymore, and I really like to have a solution for that.
Okay, and what brought you to the idea of trying stem cells? Specifically, I mean, what have you heard or seen about stem cells that you decided to try?
I heard a podcast where one of the famous, I can't remember his name, actor.
Mel Gibson.
Yes, you know that podcast.
Yeah, of course.
Mel Gibson.
Yeah.
Mel Gibson talked about his father and how he got better during the stem cell treatment. And I wanted to give it a try, so I started to Google and found out that Swiss Medica company, which seemed reliable and trustful.
And how did you understand that it seems reliable and trustful? Because many people actually state that we look like a scam.
Well, for me, first of all, the communication by your representative, Karen, was really trustworthy. She never forced it too much, all the questions or questionnaires. Then I found out your Facebook page, which has like 12,000 followers or something like that. It's quite a lot. That's very trustworthy. Plus, you had many videos and success stories, like real person talking.
Okay. Have you considered different clinics among Swiss Medica?
No, I didn't, because I couldn't find any others like too easy. I saw one in the States, but it's, for me, it's far away and it's much more complicated to get there.
And what were your expectations before coming to the treatment? What did doctor tell you? What should you expect and what you shouldn't expect about it after the treatment?
Well, he said, or she said, it was a female doctor, said that you have had many success stories on my conditions, so it's possible that my knee gets better. And as it's actually my only option to get my knee better, I was willing to take the risk. So whatever, after, even if I don't get the result, I know I used all my options now, and the next thing is to replace my knee, basically, if I wanted to.
You mean you did your best? Yeah, okay, got it. Have you got any fears or concerns of trying stem cells?
No.
No? Okay. Can you please walk me through the process of the treatment? How was it for you? Was it painful? How the ordinary procedure looked like?
First of all, physiotherapy. There were many interesting and new things or new treatments I never experienced before. Magnetic, electric, some laser stuff that was really interesting and made my knee feel less painful, like already there. Then the injections to my knee, it was really uncomfortable with the needles under the kneecap. And actually I had like 3 needles of stem cells. I don't know how many are there altogether. One was under the kneecap, and the others were around the knee. So the around the knee injections were even more painful. Oh, I can't say even more, but they were really painful, like very uncomfortable. But well, you know, it lasted only like 5 minutes or like 10 injections altogether, so it was bearable. And after that, my knee was a little bit like gentle, little bit swollen up. But you know, it's normal when you have fluid in your muscles around the knee and then inside the knee. So, but after the second day, it was already almost like it was before, and today it's back to normal again. Like it's not like treated, but there's no like procedure made swollen or hurt anymore. So now getting few more physiotherapy sessions and go back and start working on my degraded muscles to get my knee under shape. So that's it.
Did you have infusions, IV infusions of stem cells?
Yes. Inside the vein as well, yes.
Inside of the vein as well.
Yeah.
And what type of stem cells did you got to the knees and through IV?
I don't know.
You don't know. Okay. Did you have some kind of inhalation of exosomes or stuff like that?
No.
No.
I didn't.
Okay.
Oh, then I get the IVs for B vitamin.
Vitamins, yeah.
Yeah, C vitamin. There's some amino acids. I can't remember them all.
Okay. Okay. What did doctors tell you about if to expect the result, when it should come? Should it be like immediately or during some time?
They say it's up to 6 months when it can get better. Usually sometimes improvements show like in a week or 2 already, but usually it's up to 3 months when you have like all the good benefits out of that. Yeah, other than that, we just need to wait and look for the results. It's not like immediate painkiller like aspirin or something. It gets the pain away right away. So.
Before coming to the clinic, have you consulted with some doctors?
Yes, I did.
And what did
I
they tell
consulted my surgeon who's done 2 surgeries on my knee, and did a fresh MRI to check if another surgery before the stem cell therapy is needed, maybe to clean it up. But my knee was all clear, and he said that he can't help me with my condition anymore. With the surgery, it doesn't help anymore. So, and he thought that the stem cell therapy can be an option, but he can't really have an opinion because he doesn't have any experience with the stem cells. In Estonia overall, there's not much experience with stem cells. Not many doctors know about it, we're not talking about it. So
what's the general expression about the clinic? I mean, accommodation, doctors, nurses. Did you feel that they're quite experienced, or vice versa, they were not experienced at all?
well,
You can be honest, of course.
yeah, I mean, I can't really know about the experience of the like overall doctor. I mean, I can't have an opinion because I don't know anything about stem cell stuff, you know. I just trust them, but they are really friendly. And of course, the physiotherapist Ivan is, I can see he's very, very confident, and he's like really good professional. Because with my knee condition, first when he saw my MRI, he said that you need to work on your muscles to keep your knee like healed or whatever. And it's like He said my kneecap is on the wrong position actually. Nobody has told me that before, so I didn't know about it. So continuous physiotherapy should train my special little muscles and keep my knee healthy.
Mhm. What are the things that you didn't like in the clinic, in the treatment process, in the communication?
Yeah, but I want to add that everybody is really, really friendly here. I feel like home. Feel taken care of. Food is decent, and I can choose the menu, basically whatever I wish for. They didn't have the king crabs though. But I mean, the regular homey food is done really, really great, and I feel welcomed here. That's the most important thing. And now back to your question.
Yeah. Yes. What you didn't like?
What I didn't like.
Or in other way, how we can be better, how we can improve our services.
Maybe the rooms, I don't know, the light should be like more, it's like white light now. Maybe it's more comfortable if it's like a yellow light. It makes it more comfortable. And room should be maybe more cozy, maybe some painting on the wall or something like that. It's white now, so it makes like feel like in a hospital, which in a way it is. But, you know, it's like not the hospital in a regular way. I come here to treat a condition which doesn't really need like hospital intervention. It's more like a spa or something like this. Like you come here, they like take care of my knee, try to improve it. So maybe the environment inside the room could be a little bit more cozy.
Okay, thank you very much. Would you like to say something additional? Anything you would like to add? I didn't ask, but you want to share with us.
Well, the stem cell, like science of stem cell, is very, very inspiring to me. I'd like to get to know more about it, and if I get a good result, I'm up for introducing your clinic in Estonia. I mean, I could be a sales representative or whatever. It's very fascinating area to me, of stem cell therapy, and I can see that it could help like range of people with different diseases which they can't really get healed on the traditional medicine.
And how long did it take you from watching a podcast with Mel Gibson to coming to the clinic, approximately?
I think 2 to 3 years.
Okay, quite long, right?
So I didn't get straight into it because, you know, it doesn't really bother my everyday life. It's not as bad, you know, but now I have 2 small children at home. One is like 11 months and is 2.5 years. So I started to thought that I really want to go and do sports with them, or go downhill skiing with them, or play volleyball, whatever. I mean, and that's why I get into that now, to really give it a chance. And if it's not possible, then it's not possible. But at least I tried all the possibilities that's out there.
Finger crossed, and hope you benefit as much
Yes,
as possible. Thank you very much.